Everybody, Dr. Barron here with virtualheadacheспecialist.com. I'm going to talk today about Botox, not for chronic migraine, which is what you're thinking, but for trigeminal neuralgia. The trigeminal nerve is central to migraine. Its innervation is the source of all pain in the face, sinuses, teeth, inside and outside the head, and most headache disorders. It's also the source of trigeminal neuralgia, which is a severe electrical zapping, shocking pain in the face, debilitating pain, lasts seconds, up to 2 minutes maximum by criteria. If it goes longer than 2 minutes, it's not trigeminal neuralgia by criteria. But typically quick electrical jolts lasting a few seconds. Some people have a persistent low-level background pain, some people don't. There are many types of medications we use, mostly anti-seizure medicines, some antidepressant anxiety medicines that work for pain. Some people do great with the first-line medicines, others can't tolerate the side effects or they just don't respond to them. Some people can be a candidate for a surgical procedure known as microvascular decompression, or MVD, or gamma knife radiosurgery, which is a laser treatment, and these are done by neurosurgery. So the FDA approved Botox for chronic migraine prevention back in 2010. The Preempt trial was a big trial that determined the best pattern for Botox. And not to go into great detail, but essentially Botox works by stopping that electrical pain signal communication between trigeminal nerve endings from the face and the head to the brain. So it stops the release of a protein into the synapse, which is the space between the neurons, to communicate that electrical pain to the brain. So you're disrupting that pain talk. Some headache specialists use Botox off-label for trigeminal neuralgia. However, unlike Botox for chronic migraine, there's no consistent uniform FDA-approved pattern that has been through the rigors of a scientific study like we have for chronic migraine. So the pattern sometimes is a bit of a wild west. You want to have somebody that does a lot of it to try to have a good chance at it improving. So if you failed or not tolerated multiple different medicine types, you're not a candidate for, or you're not interested in a surgical procedure, Botox is something to ask your headache specialist about for trigeminal neuralgia. A lot of people that we see have never heard of this option. It's never been brought up to them, so it's important just to know about it. There's a general pattern that we tend to use based on a small study that was published back in 2016 right here, if you want to check it out. However, most of us tweak this pattern based on that small study by adding or subtracting various spots based on the facial pain locations. So in this following illustration, I've highlighted all the spots with either 5 units or 2.5 units that we target throughout all 3 divisions of the trigeminal nerve. There's 3 branches of that nerve, and we base the targeting and where we put it based on your pain location. So the illustration shows all the spots highlighted. That's not how we do it. We don't do all these spots at the same time. We do the areas that are most painful. So we use this more of a kind of a roadmap to formulate a more precise treatment pattern that we're going to do. Predominantly, we inject the side of the pain, not surprisingly, but we do add a few spots on the other side of the face where there's no pain, and the purpose of this really is to maintain facial symmetry and muscle balance so you don't have any significant weakness on one side or the other. So anyway, a lot of people we see have never heard of Botox for trigeminal neuralgia, never heard this option. It's never been brought up to them. So it's just something to keep in mind once you've been through all the typical treatments and you're just not making progress. It's a miserable type of facial pain to have, and so there are quite a few patients that do quite well with it. So if you are one of those people that haven't responded to anything, something to ask your doctor about. Anyway, if you guys have questions, drop them in the feed and I will get to them. All right, everybody have a good day. Bye.